Good morning, everyone. My name is Stella Yangzee Sherpa, and I'm a clinical psychologist and also a UGC-NET JRF awardee. I welcome you all to today's lecture class. So in today's lecture, we are going to discuss different kinds of psychological tests. And within this topic, we are going to explore a lot of different kinds of psychological tests. The first one is intelligence tests. Second is personality and projective tests. Then we have neuropsychological tests. After that, we shall look at psychometric scales and tests, and lastly, Indian tools and test batteries. Okay. After this class, I'm pretty sure and confident that we will all have a clear understanding of the different types of tests and the structure, also their purpose. All right. Next, we shall start with intelligence tests. So under intelligence tests, we have Stanford Binet intelligence scales, which was developed by Binet Simon, Alfred Binet, and Theodore Simon in 1905. It was revised by Lewis Terman in 1916. The current version that we're looking at is Stanford Binet Test 5, which was revised in 2003. Age range for this is from 2 years to 85 plus. There are basically 5 factors, can range from verbal to non-verbal. Some of them are fluid reasoning, knowledge, quantitative reasoning, visual spatial processing, working memory. Okay, that it might take 45 to 75 minutes to complete the scale. Next, we have Wechsler's scale, which was given by David Wechsler in 1939. The first scale that we are going to discuss is Wechsler's Adult Intelligence Scale 4, which was given in revised in 2008. It is for adults 16 to 90 years. It has 15 subtests. Some of them are verbal comprehension, perceptual reasoning, working memory, etc. Takes about 60 to 90 minutes to complete. Then we have WISC, that is Wechsler's Intelligence Scale for Children, the 5th edition that came out in 2014. It's for children from 6 to 16 years of age. It has 21 subtests. Can take about 65 to 80 minutes to complete. Some of the subtests are verbal comprehension, visual spatial ability, fluid reasoning, working memory. Next Wechsler scale is Wechsler Preschool and Primary Scale of Intelligence, the 4th edition, 2012. Okay, it's for preschoolers from 2 years 6 months to 7 years 7 months. Okay, and then there is another group that is 5 years to 4. No, not another group. Sorry, there is another. We have to understand there are 5 to 14 subtests depending on the age group. Okay, it takes about 30 to 60 minutes to complete this. Next, very important intelligence test is Raven's progressive matrices. It has 3 tests basically. They are all non-verbal and it assesses abstract reasoning. The first one is SPM, that is for 6 plus 6 or above 6. Then we have colored progressive matrices. It's for children from 5 to 11 and elderly individuals, also individuals with intellectual disability. Then we have advanced progressive matrices for highly intelligent adults. All right, it takes about 45 to 60 minutes. Next, we have Cattell's Culture-Fair test. It was given in 1949, designed to be culture-free, non-verbal. There are 3 scales. The first scale is for 4 to 8 years, second scale is for 8 to 13 years, and the third scale is from 13 plus years. Okay, and it can go on about to adults. Basically, it has series, classification, matrices, topology. It takes about 20 to 50 minutes. Next, very important test is Bhatia's Battery or performance test. It's for children 11 to 16 years, and it basically has 5 non-verbal subtests. That is post-block design, pass-along test, pattern drawing, immediate memory, picture construction. Okay, it's used for. It's also used for. It's useful for people who have low education or are illiterate. The next, last intelligence test we are going to discuss today is Malin's intelligence scale for Indian children, that is MISIC, which was given in 1969. It is adapted from WISC, that is Wechsler's intelligence scale for children. Okay, it was adapted from that. The age range is 5 to 15 years of age. It has 11 subtests from basically 6 verbal and 5 performance tests. It takes about 60 to 90 minutes to complete the test. Moving on. Very important. We have personality and projective tests. The first personality test is MMPI-2. Okay, but overall we can say that MMPI was given by Hathaway and McKinley in 1943. There are many forms: MMPI-II, MMPI-A. Okay, MMPI-II has 567 items. MMPI-A is for adolescent. All right. There is a shorter version of MMPI-II RF with 338 items. It has 10 clinical scales and few validity scales. Takes about 60 to 90 minutes to complete. Then we can move on to 16 personality factor questionnaire given by Raymond B. Cattell in 1949. It has a lot of edition. The fifth edition has come out in 1993. It can be given to people who are 16 and above. Measures 16 primary factors plus 5 global traits. Form A has 185 items. It takes about 30 to 50 minutes. There is Form B, Form C, Form D, depending on the education qualification of the individual. Those forms are given. Next is Essence Personality Questionnaire. Okay, this is EPQ revised, which was which came out in 1985. Age range depends on the forms. Adult form is 16 years and above. Junior version is 7 to 15 years. Okay, the item that is full item, full item has 100 items, and the shorter version has 48 items. Scales basically, it assesses extroversion, neuroticism, psychoticism. There's also life scale. Takes about 20 to 30 minutes. Next, we have NEO-PI revised. That is Neo Personality Inventory revised, which came out in 1992. The updated version is NEO-PI-III that came out in 2010. It can be administered to individuals 17 years and above. And also, it has 240 long items in the long form, 60 items in the short form, that is NEO-FFI. It assesses the big five, that is the ocean, neuroticism, extroversion, openness, agreeableness, conscientiousness, with basically 30 phases. And it takes about 30 to 40 minutes. Now let's talk about Rorschach in-block test. It has 10 cards. We can go by the Wechsler's comprehensive system. It can be administered to 5 years children and above. Okay, it has 10, like I said, 10 in-block cards. Focuses on perceptual processes, personality dynamics, underlying conflict. Takes about 45 to 90 minutes. Okay, next we move on to thematic apperception test, and it's very important to know that there are 31 cards. Usually only 10 to 20 are administered. Elicits stories. Through stories, it reveals motives, needs, conflicts. It can be administered to anyone above 12 plus. But there is children's apperception test that is for children of the age range 3 years to 10 years. Okay, it has 10 cards, and both the 10 cards have animal-like figure and human-like figure for the same situation. Okay, next we move on to the last personality and projective test, that is sentence completion test, that is SCT. Okay, why given by Reuters is 40 to 60 incomplete items, incomplete sentences. It's basically a quick projective method for motives, conflicts, and attitude. Some designed for children as well as young as 5-year-old, and others for adolescent and adults, extending into older adulthood, even up to the age of 79. All right. Next, we come to a very go to the next topic or next test type of test, that is neuropsychological test. The first one is Bender Visual Motor Gestalt Test. We call it BGT. It was given in 1938 by Loretta Bender. Can be administered to 3-year-olds to adult. Administration takes about 10 to 20 minutes. Okay, it's about copying 9 geometric figures. So optional recall is there, reproduction after the delay. All right. So it is all about visual motor integration, perceptual maturity, possible brain dysfunction, etc. Next, we have trail making test. Trail making, part of the Army individual test. It can be administered to anyone who is 15 or above, and takes about 5 to 10 minutes. Okay, it's all about connecting numbers in sequence. All right, then there's part B. This is the first part. Then part B is about alternating between numbers and letters. Okay, this test is used to measures processing speed, divided attention, and setting or set shift and also set shifting ability. Okay, next we have Stroop test, Stroop color word test, given by J. Ridley Stroop. It can be administered to 7-year-olds to anyone above that age. and takes about 5 to 10 minutes. Okay, there's some subtests are word reading, color names printed in black, color naming, basically colored squares or any X's. Then there is color word incongruence condition, where red is printed in blue ink. All right. Purpose is to measure the selective attention, cognitive inhibition, and processing speed. Next, very important test is Wisconsin card sorting test, which was given in 1948 by Grant and Berg. It can be administered to anyone who is 6 years, 5 months, years, and above. And administration takes 20 to 30 minutes. It basically the card is sorted by color, form, and number, and it is based on feedback until the new rule shifts. Okay, how? Basically, they'll give you a set of figures. Accordingly, you will have to match which one is the correct answer. Then basically it helps evaluate abstract reasoning, problem solving ability, set shifting, and cognitive flexibility. Very important. Next, we have PGI Memory Scale. It was developed by Dwarka Prasad and N.Wei. Can be administered to anyone who's 20 and above. Okay, 20 to 45. It takes about 30 to 45 minutes. It has 10 subtests. Some of them are recent memory, mental balance, attention, concentration, delayed recall, retention, and similar parts, dissimilar parts. Okay, visual retention, recognition, etc. Then we have Wechsler's memory scale. All right. In Wechsler's memory scale, which is a part of it is also part of Wechsler's adult memory scale. It can be administered to anyone who's 16 and above. Takes about 30 to 45 minutes. And it has some of the subtypes are auditory memory, logical memory, verbal paired, associate, etc. Okay. Next, the last one is Corsi Block tapping test, developed by Philip Michael Corsi. Can be administered to anyone who's 5 years and above. Administration takes about 10 to 15 minutes. Examiner taps a sequence on block and the subject needs to repeat it forward or backward. Okay, assesses visual spatial, short-term memory, and working memory. Next, we move on to different kinds of psychometric tests. Okay, in psychometric tests, we have Hamilton Depression Rating Scale, HAM-D, 1960. It was given in 1960. Age range, it's for adults. Okay, anyone who's 18 and above. And the time limit, it takes about 15 to 20 minutes. And there are basically 17 to 29 items depending on the type of form that has been given. Also, we have the second one is Hamilton Anxiety Rating Scale. It was given in 1959. This for adults, the time limit is 15 to 20 minutes. Okay, 14 items covering all aspects of anxiety. Then we have Beck's Depression Inventory. It can be administered on anyone who is 13 and above. Takes 5 to 10 minutes. Has 21 self-report items. Okay, covering sadness, pessimism, fatigue. Okay. Next, we have Yale Brown Obsessive Compulsive Scale, Y-Box, 1989. It was given in that year. Age range is for adolescents, there's children. Even there's a version for, like I said, adults. Time limit is 30 minutes. And it has 10 core items, basically assessing someone's control of obsession, compulsion, etc. Next, we have is Child and Development Assessment, like Vineland's Social Maturity Scale, which was given in 1969. Okay, there are 89 items according to age range. All right, it can be administered to anyone who's 0 to 15. Time limit 20 to 60 minutes. Okay, there are some domains that self-help, locomotion, communication, self-direction, socializations. That is the important one. Next, we have is Child Behavior Checklist. In Child Behavior Checklist, it can range from 1 year, 5 months to 18 years with 99 items. And then, 1.5 years to 1.5 months to 18 years, either with 99 items for 1 year, 5 months to 5 years of age, and 113, that is 113 items for anyone who's 6 to 18. Time limit, it takes about 15 to 20 minutes. Okay, it's a parent report questionnaire. It basically talks about internalization problem, externalizing problem, Okay, it's about screening for behavioral and emotional problem in children and adolescents. The last one, but not least, is Denver Developmental Screening Test. It is for infants from birth to 6 years of age, takes about 20 minutes. It has 125 items with 4 domains: personal, social, fine motor, adaptive, language, gross motor, etc. as assessed. The last topic of today's lecture is Indian tools and battery. Very important. This has been constructed for Indian population. NIMHANS Neuropsychological Battery, that is NNB. It's for people who are 16 and above till geriatric. It takes about 90 to 120 minutes. Very important, and you need to be highly skilled and highly trained to conduct this. Some of the subtests are attention and executive functioning, memory, visuospatial, and constructional ability, language, motor function, etc. It is basically a comprehensive assessment of cognitive domains, which is culturally relevant for Indian population. Okay. Next, we have AIMS, Comprehensive Neuropsychological Battery. It can be administered to anyone who's 16 and above. Hindi-speaking population, takes about 2 to 2.5 hours. Okay. Motor function, sensory, perceptual. Okay. And then other attention and concentration. These are the areas that are being tested. Basically, it gives you the detailed brain behavior assessment, provides lobe-wise impairment index used in epilepsy, head injury, etc. Last is PGI BBD, that is PGI battery of brain dysfunction. Given in 1980s, age range is 20 to 45, the time limit is 90 to 120 minutes. It has a lot of scales within it. There is PGI Memory Scale, performance tests like Corsi Block and Bhatia Battery, visual-motor coordination, Bender Gestalt, WAIS subtests like digispan and arithmetic, attention, perception, learning, etc. These are used to screen and assess the organic brain dysfunction and use brain dysfunction score wide, and it is widely used for certification in India. Okay, the key difference is NIMHANS battery is about modular and flexible multiple version and has multiple version and also is broadly used in research. Okay, AIMS is also very detailed. It's in Hindi, provides lobar impairment. Okay, understanding of the lobar impairments. Then we have a PGI BBT, which is specifically designed for organic brain dysfunction screening. So we have to understand in today's lecture, psychological tests are powerful tools that allow us to assess different psychological constructs, okay, and clinical condition in a very scientific way. And we look at some of the most widely, we have already looked at it, the most widely used tools. The key takeaway is that each test has its own purpose, its own structure, and cultural context. We come to the end of today's lecture class. Thank you so much.